Hello, my name is Christopher Fritel, and I've been teaching at TLC since 2002. On September 12th and 13th, I'll be hosting a workshop that focuses on addressing temporomandibular joint dysfunction. TMJ is a problem that many people deal with, and at this workshop we will be assessing whether you and your clients actually have temporomandibular joint dysfunction. Assessment, treatment, and self-care tips will be learned, and we will look specifically at the muscles of mastication that are involved in temporomandibular joint dysfunction. Some of the common muscles are masseter and temporalis, but we'll look at some other lesser known muscles that are on the underside of the jaw called suprahyoids, and then down through the front of the throat, which are called infrahyoids. Okay, let me give you a quick example of some of the muscles that we'll encounter in this workshop. We probably are already familiar with the masseter here on both sides. We also have up near and around the ear the temporalis muscle, both muscles of mastication, primarily for elevating the mandible. But we'll also look at muscles that depress the mandible, located on the underside of the jaw here. Because they're above the hyoid, we call these suprahyoid muscles, and they include the mylohyoid and the geniohyoid. There's also a muscle in there called digastric. We will palpate underneath the mandible here for inflammation, hypertonicity, inflammation, or tender points that the client may report. Then from below the hyoid bone down towards the clavicles, we have infrahyoid muscles whose job it is to pull the jaw down as well. Those muscles are a little more difficult to access, but they will be easy to isolate when we ask the client to depress the jaw. Great, thank you. In addition to palpating and treating the muscles of mastication, we'll also check the quality of jaw movement before the treatment and after the treatment. This will include mandibular depression, lowering the jaw, and lateral deviation, sliding the jaw off to the right and off to the left. Good.